Hi, I'm Dr. Michael Kelly, and this is my CoolSculpt experience. This is a new series that we started where we interview people who've actually had the CoolSculpting procedure, and so we can find out what it was like for them. We're doing this so that potential patients will be able to hear the words right out of the mouth of people who've actually had it done. They can see what it was like, and then hopefully that will allay a lot of their fears about what might happen during this procedure. Because I was wanting to document my experience, we actually filmed one of my treatments. So we're going to cut to that now and let you see what I experienced as they were actually doing the procedure.
Dr. Kelly, are you ready for your CoolSculpting experience?
Yeah, I'm a little nervous. I don't know what this is going to feel like, but I'm excited.
Don't worry, I'm going to walk you through all the steps. The first thing I'm going to do is apply a cold gel pad, okay?
Okay.
All right, here we go. Okay, here we go. It's going to feel a little cold. So I'm just going to massage this area out. This gel pad is going to help with desuction. Everything you're going to experience is extremely temporary. We're talking seconds to maybe minutes. Okay, that feels better now?
Yep.
All right, perfect. Okay, so ready for step 2? I'm going to place the applicator over the gel pad and start the suction.
Great.
Okay, here we go. How you doing?
No big deal.
I know, it's pretty easy, right? Not too
It
bad.
feels like you just, you stuck your hand on the end of a vacuum cleaner,
Exactly.
It's just that sensation of your skin being sucked against
Kind of tugging on you a little bit. Now, after 30 seconds, this gets much more comfortable. So the worst is basically over. What you're feeling right now is just the suction. The cool is going to start kicking in. You might feel maybe a warm sensation around the area, but other than that, you're officially CoolSculpting.
Yeah, I mean, this has got, I would describe this as discomfort. And on a scale of 10, I would say it's a 1 to 2.
Perfect,
I mean,
that's perfect.
Not a big deal.
So the next important thing is I'm going to get you even more comfortable. I'm going to go ahead and place this behind your head, let you kind of relax there for a second. I'm going to turn the lights out, and now you can relax and enjoy your CoolSculpting experience. We have TV. You can actually take a nap if you wanted to. You can bring your laptop and do some work, whatever you choose to do for the remaining part of the procedure. So you've got about 57 minutes left.
All right.
Okay.
Do you have the remote, and I'll go ahead and watch
I do,
TV.
sure. Let's get this on.
Get some Sports Center at it.
Yeah. Okay, Dr. Kelly, you're all done with your CoolSculpting experience. How was it?
Easy.
All right, great. I'm going to go ahead and take the applicator off now. I'm just going to turn the light on. And if I can take the remote from you.
Okay.
How was Sports Center?
It's great. Sorry, we're done.
We're done. Didn't get enough time to watch it, huh?
No, I don't usually get this luxury.
Okay, I'm going to go ahead and take the suction off now. Okay, you're going to feel a little bit of pressure as I remove the applicator. Okay, you doing okay?
Yeah.
Okay, I'm going to remove the gel liner. The area is going to be a little bit pink. And I'm going to massage the area out now, okay?
Okay.
This part may feel a little bit uncomfortable, just for maybe a few seconds to a couple of minutes at the most. You doing okay?
Yeah, that feels a little weird. I would say probably on a scale of 10, that's a 2 to a 3.
Okay.
But definitely tolerable.
It should always be getting a little bit easier. Okay, that's it. You're all done. You're officially CoolSculpted.
That was no big deal, and I absolutely have no pain now.
Great.
Definitely it feels a little numb here, but that's to be expected. I'm ready for you to do the next.
Ready for the next area.
Spot.
Let me just clean the gel off here, and I'll let you get dressed.
So as you saw, it really was a pretty easy procedure to do. Right now, I'm about 8 weeks out from the second treatment that I had done. The reason I did 2 treatments, and I recommend 2 treatments for all of my patients, is that I think doing that extra inflammation to the fat cells in the short period of time after the first treatment makes the overall effect better. And so I did my first treatment, I waited about 2 weeks, and then I treated myself again. And now I'm about 8 weeks out, and the results are really pretty impressive. I'm pinching less fat, and we're going to show you the pictures so you can see for yourself the amount of improvement I got with the 2 CoolSculpting treatments. Now I did 4 spots. I did 2 on the front and 2 at the back. so you can really assess that. I did have some numbness for about 3 weeks after the procedure each time, and you know, I could definitely feel that, but to me it just showed me that the procedure was working. It really didn't interfere with my life at all. Other than that, it was really no big deal. It was nice not having to have anesthesia. It was nice not having any downtime, and I'm really happy with the results. So I hope that you'll find this little series helpful, and you'll be reassured so that you'll know that when you have your CoolSculpting procedure, that it's really not going to be a big deal. There's really not pain, and the recovery is very easy. Thanks for watching.